Welcome to Open Enrollment 2012. My name is Beverly Kay, and I am Benefits Coordinator for Valdosta City Schools. During this time together, we will be discussing all of the information you will need to complete your 2012 Open Enrollment. The annual Open Enrollment period for the 2012 plan year begins at 4 a.m. on Tuesday, October 11th, 2011, and will close at 4:30 p.m. on Thursday, November 10th, 2011. The 2012 plan year will begin January 1st, 2012 and go through December 31st, 2012. Your new coverage will begin January 1st, 2012. Your premium changes will be seen in your December check. Emeritus Dental and Vision Coverage. Emeritus Dental plans are the same as last year with no changes to the plans or premiums. The Emeritus Vision plan has no change to the premiums. However, we have added some enhancements to the plan. The deductible for an exam has been reduced from $15 to $10. The deductible for lenses has been reduced from $15 to $10. And if you choose contact lenses instead of glasses, the benefit has increased from $115 to $130. If you do not wish to make any changes to your Emeritus Dental or Vision coverage, you need to do nothing, and your coverage will continue through the 2012 plan year. Nan Troutman, our Emeritus Dental and Vision representative, will be visiting schools throughout the open enrollment period to help with enrollment and any questions. She will be posting her schedule at each school. AFLAC. Troy Black with AFLAC will be coming to your school to update your cafeteria plan and to offer additional insurance you may be interested in purchasing, such as a cancer policy or short-term disability. Please contact Troy Black at 229-251-5830 concerning any AFLAC changes. Salary redirection. Valdosta City Schools participates in a cafeteria plan under IRS Section 125, which enables us to apply pre-tax advantages when eligible. All employees need to meet with Troy Black, who handles our cafeteria plan, to sign their salary redirection for pre-tax advantage for the 2012 plan year. Troy Black will be visiting each school to administer the paperwork. Sick leave bank. Eligible employees may discontinue or enroll in the sick leave bank during this open enrollment period. Please contact me, Beverly Kay, at 671-6055 or email me at bkay@gocats.org and let me know of any of your changes. TRSGA, Teachers Retirement System of Georgia. Remember, TRS statements will only be available online. All members are encouraged to go online at www.trsga.com and register to establish an account in order to download an annual statement and update beneficiaries. State Health Benefit Plan. The annual open enrollment period for the 2012 plan year begins at 4 a.m. on Tuesday, October 11th, 2011, and closes at 4:30 p.m. on Thursday, November 10th, 2011. Employees will need to make their health benefit selection online at www.myshbp.ga.gov. Open enrollment is for any eligible employee who is enrolled in State Health Benefit Plan to continue their coverage, or any eligible employee who has previously declined coverage to enroll. SHBP participates in mandatory online enrollment. Even if an employee does not want to make a change in coverage, he or she must go online and answer the surcharge questions. Failure to answer surcharge questions may result in a premium increase. The 2012 plan year will begin January 1st, 2012 and continue through December 31st, 2012. There are many state health benefit plan changes for the 2012 plan year. You will need to register on the website before you can make your 2012 election. After making your election, remember to print your confirmation, which includes your confirmation number. You may go online as many times as you like, but the last election confirmed at the time open enrollment closes will be your election for the 2012 plan year. Once open enrollment is closed, you will be able to go online to www.myshbp.ga.gov and view your 2012 election. Active employees will have until December 31st, 2011 to report any election errors made during the open enrollment period. Report those errors to your benefits coordinator. Once coverage goes into effect, SHBP will not allow a change. You must answer the tobacco surcharge and spousal surcharge questions online. There are no changes to the surcharge amounts. However, there will be a spousal surcharge verification audit implemented during the 2012 plan year. SHBP will require documentation to be submitted from members who cover their spouse but are not paying the spousal surcharge. The federal law has changed and now allows children of members covered under SHBP to enroll in the Peach Care for Kids program. Children must meet Peach Care for Kids requirements. Benefits will include dental, vision, and health insurance. There will be a link to the Peach Care website, which will include an eligibility calculator to aid in determining if your child qualifies. Please contact Peach Care at 877-427-3224 for enrollment information. A TRICARE voluntary member pay all supplemental health benefit is available to SHBP eligible individuals who are also eligible for TRICARE, which is the military health benefit program. This program is not available to members over 65. Certain tobacco cessation medications will be covered in all plan options when prescribed as part of a tobacco cessation program. Bariatric surgery will no longer be covered under any plan options. SHBP now allows 90 days to request a continuation of coverage for a surviving spouse or to add a newborn. All other qualifying events must be completed within 31 days. SHBP is offering a new wellness plan. Included in the HRA, Health Reimbursement Arrangement, HMO, Health Maintenance Organization, and HDHP, High Deductible Health Plan options. If you choose the wellness plan, members and covered spouses each must promise to complete an online health assessment and obtain a biometric screening between July 1st, 2011 and June 30th, 2012. Biometric screenings results must be received by your healthcare vendor by June 30th, 2012. The physician screening form will be available to download on January 1st, 2012 at www.myshbp.ga.gov. If a member or his or her covered spouse does not honor their promise, the wellness plan will not be offered as an option the following year. Rewards for enrolling in the wellness plan are lower premiums and lower out-of-pocket costs through co-payments, co-insurance, deductibles, and out-of-pocket maximums. There will be a disease state management pharmacy co-payment waiver only in the Health Reimbursement Arrangement and Health Maintenance Organization wellness plans. The $125 preventive incentive for the HRA, which is where members complete their health assessment and their physical, will only be available in the wellness plan. SHBP is offering a new standard plan included in the HRA, HMO, and HDHP plan options. The standard plans offer the same services as the wellness plans, except there is no promise to complete your health assessment and obtain a biometric screening. There are higher premiums and higher out-of-pocket expenses through co-payments, coinsurance, deductibles, and out-of-pocket maximum. There is no $125 preventive incentive for the HRA and no disease state management pharmacy copay waiver. The HRA wellness and standard plans have different HRA dollar amounts awarded at the beginning of each year. The wellness HRA contribution will be $500 for individual, $1,000 for you and spouse, $1,000 for you and children, or $1,500 for you and the entire family. Under the standard HRA, the contributions will be $375 for you, $650 for you and your spouse, $650 for you and your children, and $1,000 for you and your family. The HRA wellness and standard plans will have the same pharmacy benefit for the 2012 plan year. Pharmacy costs will no longer apply to the deductible or out-of-pocket limit. HRA dollar credits may be used for prescription drugs, but will no longer help offset your deductible or out-of-pocket limit. The benefit will change to a 3-tier structure with a minimum and maximum out-of-pocket expense. Under the prescription drug coverage, please review the chart and review the tiers and the minimum and maximum amounts for each of the retail pharmacy, the 90-day retail pharmacy, and the 90-day voluntary mail order pharmacy amounts. Please note, United Healthcare members will need to provide a separate healthcare spending card to their pharmacist to access HRA credits for their pharmacy expenses. They will also need to present their UHC ID card. A separate card is not required for Cigna members at the pharmacy. Some of the HMO changes are, if you're going to a primary care physician under the wellness HMO plan, you'll pay a $35 copay. Under the standard plan, an HMO copay. If you see a specialist, you will pay $45 copay under the wellness plan and $55 copay under the standard plan. The deductibles and out-of-pocket maximums did not change for the 2012 plan year. The $200 annual vision benefit for glasses and contacts will no longer be offered. And please review the pharmacy 90-day mail order, voluntary mail order chart. It is new this year. The high deductible health plan wellness and standard out-of-pocket comparison chart will help you in reviewing what your out-of-pocket costs will be and what your deductibles will be. Please review the chart before you choose a plan. The high deductible health plan coinsurance and pharmacy comparison is also available to you online. Please note that the 90% in-network and 60% out-of-network under wellness is after deductible, and also under the standard plan, 80% in-network and 60% out-of-network is after the deductible. Employees who enroll in the wellness plans will see an increase of 11% from the 2011 plan year. Employees who enroll in the standard plans will see an increase of 17% from the 2011 plan year. Please review the entire rates chart so you can see the difference between each plan and the amounts that you'll be paying each month, and also the new TRICARE supplement amounts. Please contact Cigna or United Healthcare for additional questions. Those phone numbers will be posted online. A PowerPoint presentation will be posted at www.dch.georgia.gov/SHBP, and this will outline all of the new changes. If you are enrolled in State Health Benefit Plan and fail to go online and make a 2012 election, your coverage will default to the standard HRA, HMO, or HDHP option with your current vendor. The tobacco and or spousal surcharge will apply for the 2012 plan year. The employee will pay these surcharges for all of the 2012 plan year unless he or she experiences a qualifying event. Remember, employees are required to submit official documentation to the State Health Benefit Plan to verify dependent eligibility. Services will not be covered for any dependents that have not been verified by SHBP. The dependents coverage will remain inactive. No claims will be paid until the appropriate documentation is received and verified by SHBP. SHBP will not change the coverage tier because of a failure to verify dependent eligibility. Decision guides. Employee health plan decision guides will be available at www.myshbp.ga.gov and www.dchgeorgia.gov/shbp by September 30th, 2011. The information provided in this presentation is a summary of changes for the 2012 plan year. It is intended only to highlight principal benefits. Please refer to the Active Employee Decision Guide for more details. Provider directories. Healthcare providers can enroll and drop out of the network during the plan year. It is best for employees to call their providers to see if they will be participating in the network or go online to www.welcometoUHC.com/SHBP or www.mycigna.com/SHBP to make sure your provider is still participating. If you are a new employee and you're hired after October 1st, 2011, you may not be able to go online to discontinue or enroll in State Health Benefit Plan insurance. Please contact me at 671-6055 or email me bkay@gocats.org to complete your enrollment. Any employee who is having difficulty going online will need to contact me. I hope this session has been beneficial. If anyone has questions, please contact me and I will do my best to assist you.